being a pharmacist, for me, my inspiration is creating impact into people's lives in the health sector, in the supply chain, and every other aspect of pharmacy practice. Meet up the needs of the people by helping them improve their health and quality of life. Pharmacy profession as a whole is a versatile profession where you go to the hospitals, you see pharmacy, you go to the corporate world, you see pharmacy, you see pharmacists practicing, you go to industries, you see pharmacists. So the role of pharmacists is far beyond dispensing. There are pharmacists in the hospital who majorly do dispensing and procurement, and we have pharmacists in the industry who are responsible for production. And we also have pharmacists in the supply chain who are responsible for movement of these products, warehousing and procurement of these products from the region of production to where they're produced. So the role of pharmacists cannot be overemphasized in terms of the impact of
after my graduation, and then when I started practicing with pharmacy, I was interact with patients and then meeting their needs. The needs in place of medical needs, how you talk with patients, condition, you can be able to tailor to their needs and then respect some role that can help them. I think.
Well, as a pharmacist, you know the ingredients of drugs. I know the interactions of drugs, and when given to a particular.
This question has hit me directly because I remember I had a friend who had been helping to give medical advice and recommend some drugs. So at the time I was working in a community pharmacy, and this friend of mine came in search for a particular product which he couldn't get, and I decided to give him an alternative option which I know is going to give him exactly what he's looking for. But this friend of mine declined this decision and decided to opt out. And in the course of talking, he decided to say that he sees pharmacists as capitalists. And I'm using this juncture to make people to know that pharmacists are medical professionals which will create impact and help people. We are not after the money of the populace. But of course, you have to pay for every service that is being rendered. So the notion that I want people to know is that pharmacists are not capitalists. We are healthcare professionals, and we work to make impact in society. So as pharmacists, anywhere you find yourself, in the community, in the hospital, in the industry, you creating impact. So you come across clients where you give them advice. And of course, there are days where pharmacists engage in publicity, where like during the World Pharmacists Day, we do awareness, we do sensitization, and we create drug information to population, to people, where they get to know the impacts, where they get to know the side effects of some, the intake of some of these medications. Thank you very much. Pharmacists create awareness. How do they create awareness? By sensitization, like I said earlier. We counsel patients, clients, our friends, our families on the kind of diet or the kind of medication you should be taking, the kind of lifestyle, engaging frequently on exercises and proper dieting, which of course is the role of pharmacists in every occasion or in every four corner of the world that you find yourself. In the hospital, in the community pharmacy, you see people, you meet people, you communicate every day, even in non-governmental organizations where people get to work in the society, where in the deep field, you meet people.